It's Ashley from Demystifying Your Health. I'm so glad that you're here today. Today, we're going to be talking about kidney stones. Obviously, it's a pretty common condition, so most people know that it has something to do with your bladder and being able to go to the bathroom. But they aren't really sure what causes it, how is it treated, and what can they do to prevent it. So let's take a look. Kidney stones are also called renal lithiasis or nephrolithiasis. Renal and nephro both mean kidney. And they are hard deposits that form inside your kidneys and are made up of minerals and salts. And the way they form is that your urine becomes concentrated, so it allows these minerals and salts to crystallize, which causes them to stick together. There are four main types: calcium, struvite, uric acid, and cysteine. Calcium is further divided into two subtypes: calcium oxalate and calcium phosphate. Calcium oxalate is the most common type of kidney stone. And oxalate is a substance that is produced by your liver daily, but it's also found in fruits, vegetables, nuts, and chocolate. So if you have too much of this in your body, it causes a buildup, which can result in the kidney stone. Calcium phosphate is usually caused by some sort of metabolic condition or taking certain medications. Struvite stones are usually tied to some type of infection, like a urinary tract infection. So if you have an infection, you're more likely to have one of these type of stones, and it's important to note that they can actually get quite large fairly quickly. Uric acid stones are caused by the buildup of uric acid within your body, and this can happen through a variety of ways. One is that you're not taking in enough fluid. Two is that you're sweating excessively. Three is you're eating a high protein diet. And four is if you have the medical condition gout. Cysteine stones are the result of a hereditary condition where the body gets rid of or excretes too much of the amino acid cysteine. Despite there being so many different types of kidney stones, the symptoms are generally the same. And it's important to note that usually when they're first starting out, you're not going to have any pain. The pain really doesn't kick in until the kidney stones start to move, usually from your kidney down your ureter, which is the tube that connects your kidney to your bladder, and then obviously once it's in your bladder, or it's coming out your urethra, which is the tube that connects your bladder to the outside. So, the most common symptom of a kidney stone is severe pain in your side or back just below your ribs, usually somewhere in the back here. And then the pain can radiate to your lower abdomen, meaning it comes around from that side to the front. And the pain will vary in intensity, usually. Sometimes it's incredibly severe, other times it's not as severe, but it's still there. You can have pain when urinating. Your urine might be pink, red, or brown colored. This indicates there's some bleeding due to the kidney stone passing through your urinary system. You can have foul smelling urine, which would indicate obviously an infection. You'd have cloudy urine. The urgency to urinate, meaning that you feel like you need to go all the time. You're frequently going to the bathroom. You're only urinating in small amounts despite going to the bathroom all the time. You have nausea, vomiting, or fever and chills. And it's important to note that if your pain gets so severe that you can't sit still or can't find a comfortable position, then you should be going to the emergency room, and especially if you have nausea, vomiting, fever, chills, or blood in your urine as well. These indicate that you need to seek immediate medical treatment. If you have any of the other symptoms, you should still see your doctor in order to get any treatment that they would be able to provide you. When it comes to treating kidney stones, it really depends on the size, type, and location. For small stones, it's important to drink plenty of water. And the goal here is you want to keep your urine as clear as possible. This means you're well hydrated. The next thing you can do is take over-the-counter pain relievers, like ibuprofen, which is Advil, or acetaminophen, which is Tylenol. And your doctor might also prescribe medication to help the muscles around the ureter relax, which allows the stone to pass through easier. For large stones that are not going to pass on their own, there's a couple of different options. You've got extracorporeal shockwave lithotripsy, or ESWL. And what this is, they actually use sound waves to break up the stone and then it passes naturally. If this isn't an option, then the next thing you'd be looking at is surgery. And there's two main types of this. You have percutaneous nephrolithotomy, which is where they actually make a small incision in your back, go in, and remove the stone. The other option is using a scope that goes up through your urethra, past your bladder, and into the affected ureter, and removes the stone that way. With either type of surgery, your doctor may leave a stent in place for a short period of time. This helps with healing because obviously the area is going to be inflamed and cause swelling, so this makes sure that you're able to pass urine from that kidney down to your bladder. When it comes to preventing kidney stones, there are several things that you can do. The most important is drinking plenty of water daily. Similar to the treatment section, the goal here is you want to keep your urine as clear as possible. This means that you're hydrated and you're not allowing those minerals and salts to crystallize so they stick together. The next thing is you want to be aware of how much oxalate-rich foods that you're actually eating, because obviously if you are eating too much, it can build up in your body. You also want to be careful with calcium supplements. Talk to your doctor before you start taking any of these if you have a history of kidney stones. And eating a diet that's low in sodium and animal protein is also essential. Sodium makes it harder for your body to process certain minerals. And this is why it's so important to understand what type of kidney stone that you have. So usually when you're getting treated for one, your doctor is going to take part of it, all of it, to be able to send off to a lab to identify which of the 4 types you have. Because this is so crucial in being able to determine what you need to do to prevent one from coming back. And if you need to, your doctor might prescribe medications, and this is where it's really dependent on the type. So for calcium, you can be prescribed either a thiazide diuretic or a phosphate-containing medicine. Obviously, this really depends on if you have a calcium oxalate stone or a calcium phosphate stone. For uric acid stones, you can take the medicine allopurinol, which is usually used to treat gout as well. So this is how it helps reduce the buildup of uric acid in your body. Struvite stones, the key here is preventing any type of infection. So if you're prone to infections, your doctor might prescribe long-term use of antibiotics just to help prevent any chances of having a struvite stone. For cystine, since these are hereditary, they're a little bit harder to treat. So you might need to take medicine to help reduce the cystine levels in your body. So this is so important because obviously you don't want to have to deal with kidney stones, but until you know what type you have, it can be incredibly challenging to try to prevent one. But once you do, there's definitely several steps that you can take that will make it a lot easier to be able to be kidney stone free. No one wants kidney stones. The good news is they are treatable and preventable. So you can do everything you need to be able to avoid having one. Thank you for joining me today. Please like, comment, share, subscribe. I'd love to hear from you. Otherwise, until next time, stay healthy.